of the number of people that need treatment for addictions, typically the number of people that receive treatment is around 10 or 11%. 10 or 11%, right? Which is really incredible. And one of the reasons people don't receive treatment is because they don't feel like they're ready for treatment, and some people still think there's a stigma around receiving treatment. There's things like that, right? In certain families, people don't want to talk about addiction issues, but other reasons people don't receive treatment is just because treatment is not readily available. It's not easy to get treated for addictions. Yeah, it's very difficult, actually. And if you do get treated, typically the insurance will cover 28 days of, and that's if you're lucky enough to have some kind of insurance, and not a huge deductible, right? So it'll typically cover 28 days of treatment. But most people, what the addictionologists understand about the brain is that it takes about 18 months for the brain to get back online, that you have enough self-regulating capacity not to use again. So, I mean, 18 months should be the normal course of treatment, But it's very expensive and very difficult. Yeah. This is another reason. I think the system should change, and I think it should include self-regulating practices, especially bottom-up self-regulating practices that are not easily accessible except through these kind of intuitive meditative practices like yoga and qigong. So another reason why I think that there's an important, very important reason to have yoga included in the system. So I mentioned this earlier. This is my favorite slide. Combined healthcare costs equals yikes. Because by 2030, cardiovascular disease, chronic respiratory disease, cancer, diabetes, mental health will represent a cumulative output loss of $47 trillion. That, by the way, that number is from 2010 to 2030. So over, they're estimating over the next 20 years. That's the amount that healthcare is going to cost, and that is 75% of what the global GDP was in 2010. Yeah, so you look at that number and it's like, is that possible? It's completely unfathomable. These three changes could immediately reduce costs if we have integrative lifestyle change programs, integrative interventions for people with depression, and integrative prevention strategies to support wellness across the populations, right?